Dr. Klein joins us today, and we're going to be talking about the war between traditional medicine and holistic medicine. And I remember months and months ago, Doctor, we took a few minutes and described that there's a big disconnect between what the public thinks holistic medicine is and what it really, really is.
Well, you betcha. Okay, holistic medicine, is little more than looking at the patient in its entirety. The entire patient is looked at, not just your heart if you're a cardiologist, not just your brain and spinal cord if you're a neurologist, not just your endocrine system if you're an endocrinologist, but you look at the whole thing. Now, why is this important? Because there isn't any single organ system in your body, not one, that manifests that simply. And as a consequence, we've kind of gotten away from quality medicine into something that's very, very fractured, very inadequate, and we have a lot of people that complain that they just can't seem to get the job done because their doctors don't talk to each other, which is also somewhat intentional. So holistic medicine is little more than an approach. It's what we're all really trained to do. It's what we're all supposed to do. Unfortunately, as these things have progressed, they have gone backwards, and that's the way it goes. And so the reason why I thought that this was an important topic to go over was because of the newspaper, because of the major broadcast media, and what they'll do is they'll pick up on an article or two that may have made it through peer review, and it causes a big stink. And the one that really bothered me is one that I read in the Journal of the American Medical Association, which is not, as it might seem, to be a particularly high-quality journal. And so they went on about that fish oil, taking fish oil. Those individuals that receive fish oil do not have a change in cardiac risk, over the course of a year. And if you look at this on its surface, you would think, oh, well, gee, that's kind of interesting. These individuals, they could not demonstrate any benefit for it whatsoever over the course of a year. But then if you know your stuff, if you know how to read into these journals, and very few people actually take the time to read them line by line, critically to figure out what's right and what's wrong. They rely on somebody else's intelligence, which, by the way, is not a good tactic to take. What you found, was that it was a modest amount of fish oil over the course of 1 year, not individuals that were prescribed fish oil, but these were VA patients. These are Veterans Administration patients, not your typical traditional patient by a long shot. Having been a VA doctor for 4 years, I have got to tell you, they couldn't be any more different than the patients in my regular office. What's more, is that when you're looking at something that has a 20-year throw to it, you're not going to detect something after 1 year. This would be similar to me telling you cigarettes are safe, because if you start them now, in 1 year, you're not going to have an increased risk of lung cancer, which, by the way, is absolutely true. It takes 20 pack years before you start seeing a measurable threshold for lung cancer. Not necessarily emphysema, not necessarily chronic bronchitis or other sorts of things, or asthma for that matter, but for cancer. So to sit back and poo-poo the use of fish oil, which, by the way, is a foodstuff that we're supposed to be eating. Why? Because it gives you 2 essential, sometimes 3 or 4 essential fatty acids that are necessary to maintain health. So they go ahead and they go, well, this is obviously a bad idea because we could not measure something in 450 VA patients over the course of a year. And one thing I will tell you is that VA patients are not notorious for following instructions. They don't. This is not a regular group of people. But what's most bothersome of all about this is the fact that they're looking to take something to disempower the patients. These are things that you do not need doctors at all to start taking care of yourself. Now, mind you, they didn't come back and say that taking the prescription esterified fish oils would be less beneficial. This is $200 to $300 a month worth of prescription fish oil. If you can imagine such an abomination.
Wow.
So you can go ahead and you can spend $300 for the prescription, and that's probably okay because the studies that looked at that were just marvelous. But the fish oil that we are given by nature isn't good enough. Think about that for a second, and if it doesn't make you nauseated, then I'm going to worry about you. So what else do we want to look at? The war against holistic medicine, traditional medicine. Many of the things that we treated people for thousands of years rather successfully no longer work. They don't work anymore. They've always worked. What about those things that we used as prescription items back in 1900 through, let's say, 1990? that are no longer prescription items. Did they stop working just because they went over the counter? One of my most favorite medications is something called Mucormyst. We used to use it to treat kids with cystic fibrosis, and it worked. Guess what? It's now available over the counter as N-acetylcysteine, and now it doesn't work anymore. It's the only thing ever been shown to be able to be curative. That's to save your life with regards to Tylenol overdose. So there are a bunch of these sorts of things that are very, very easily measurable if you take the time to do it, and if you pick your patient population, and if you know what you're doing, and if you use the right dosages. And that's the key to this. So in my practice, we routinely get cholesterol levels in elderly people to the 150 to 180 range. Now, arguably, that's pretty darn good, okay? And we do it without statins. But of course, you really can't do that because you have to have a prescription statin to get the job done. Another false statement. What about using steroids in your practice? Okay, whatever happened to the one that the body actually makes most of? That's cortisol. When did it stop working? It's a prescription item. But when did it stop working and you need to use prednisone? The answer is never. It's called a xenohormone. When you start changing things that are natural, you start asking for trouble. There's a time and there's a place. Antibiotics are marvelous. Most antibiotics were derived from naturally occurring substances. These are things that bacteria use to kill other bacteria. Okay? They exist in nature. Chemotherapy agents. Okay? These are derived from antibiotics. Wouldn't you know it? Yet we're saving people's lives using poisons judiciously. You have to be very, very careful. Okay? Why? The difference between a chemo agent and a regular antibiotic is something called mammalian cell specificity. Otherwise, they're the same thing. Go figure. If you read the names of these antibiotics and then look at the chemo agents, bleomycin sounds an awful lot like erythromycin, doesn't it? Adriamycin sounds an awful lot like azithromycin. They do, because they're very, very similar chemically. The derivations were the same. So when you're looking at criticisms between regular mainstream medicine and quote-unquote holistic, understand this. There is a turf war going on right now. You don't see it. It's one ant colony attacking another ant colony. You'd be entirely oblivious to this, and should be. But why does this occur? And the answer is economic. It's financial. Twice as much money is spent in the United States and internationally on alternative medicine than on traditional. And if you don't think about it, it's about the buck, you'd be spot on wrong. It's all about the buck. Why? They want to take away your choice. They want to take away things that you know make you feel better, so that way you can be treated in feel-bad medicine. Now, I used to get into this discussion a great deal at medical meetings where I would speak. Okay, so I'd be there speaking one way, and I'd sit in the audience and get into an argument with another speaker at a different time. And it always got over this. If you're out there practicing quote-unquote feel-good medicine, what's wrong with that? If what you do as a practitioner makes people feel better, why is that a problem? Now, it'd be entirely different if you were out there dishing out cocaine. That'll make anybody feel better. You're not out there dishing out heroin. That might make everybody feel better. But what you're doing is you're treating the patient and they're feeling better. And that's a problem. Okay, it's only a problem to people that don't know how to make their patients feel better or don't care to ask. So one of the most important questions that I ask every patient that comes through my office is, how are you feeling? How are you feeling? What an interesting question. You know, I ask that question before I look at their blood pressure. I do it before I ask anything else. How the heck are you doing, Mrs. Jones? How is life treating you? Anything I need to know about you? Because these are the greater questions. These are the more sensitive questions with regards to how somebody is doing medically. That's what it's all about. Not, gee, you know, how's your blood sugar doing? Well, we may get to that. How's your cholesterol doing? We may get to that. More importantly, how are you sleeping? Are you sleeping through the night? How many times do you have to get up to pee? How are the crying spells doing? How long are your menstrual periods lasting? Are they still lasting a week, 7, 10 days? Have they shortened yet to 3 or 4 days? How frequently are they? These are the questions that make a big difference with regards to how you treat a patient. So the dichotomy, the separation between holistic medicine and allopathic medicine, that's the regular mainstream stuff, is a matter of history. In holistic medicine, we're using medications that may have been around for hundreds of years that were the mainstay of medical practice and may never have gone bad. Things like castor oil, been used for thousands of years. Thousands of years. How often, when you have an infection on the skin, does your doctor talk to you about how to use a poultice? That's an application of something to draw the infection out. Does it work? You bet it works. It works very, very consistently, yet you don't hear about it. You want a pill, you want a capsule, you want a prescription cream. They're all over it, but understand it's not all about you.
Give me a doctor any day that will take the time to talk to me and not just give me a prescription.
There you go.
I like it. All right, thank you very much, Dr. Klein. All right, folks, suffernomore.com. Check it out, suffernomore.com. And if you'd like to get on a good regimen with your nutraceuticals and not run out and not forget what you're supposed to be taking, just sign up at the stagesoflifevitamins.com, stagesoflifevitamins.com. And here's more contact information.
Our phone number is 407-679-3337, and our website is stagesoflife.net. We're located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434. And let's see, our office hours are Monday through Thursday, 8 to 5. The health store that Rob mentioned with all of our nutraceuticals is open during those office hours, but we're also on the web, as I said, at stagesoflife.net, and you can purchase your nutraceuticals at your leisure, and we will ship them to you.